Hello, everyone. My name is Favor Esomune. Today, I will be discussing on my future role as a prospective nurse practitioner psych. Please permit me to share my slide with you for a better understanding. Throughout this course, I have gained a deeper understanding of the role of an advanced nurse practitioner. And as a prospective psychiatric and mental health nurse practitioner, I recognize that these roles extend beyond providing care to promoting healing, advocacy, and compassionate service. The purpose of this presentation is to reflect on my future role as a psychiatric and mental health nurse practitioner. I will be examining how social, legal, economic, and global factors could impact on my plan. I will also identify a psychiatric and mental health nurse practitioner who is my role model and could inspire me. I will also be discussing how Christian worldview will guide and shape my future practice by utilizing one of the beatitude which I chose, mercy. Blessed are the merciful, for they shall obtain mercy. My future goal as a psychiatric and nurse practitioner, psych, is to provide a comprehensive mental health assessment and diagnosis, to deliver an evidence-based treatment, including medication management and psychotherapy. My plan is also to provide a holistic, patient-centered care by addressing patients' emotional, mental, and spiritual needs with compassion and respect. I would be advocating for policies that will improve access to quality mental health care. I will be advocating for a reduction in stigma associated with mental health illness through education and advocacy. I will be promoting mental wellness, prevention, and early intervention strategies. My plan is also to serve as a leader in advancing mental health awareness and improving patient outcome. To carry on this plan, I will be needing additional training to enhance my knowledge, such training as pursuing a continuing education in psychopharmacology and emerging psychiatric treatments, obtaining a certificate in mental health counseling and behavioral therapy. I will be obtaining specialized training in psychotherapy modalities such as cognitive behavioral therapy and dialectical behavioral therapy, and then trauma-informed care. I will also be acquiring more education in telepsychiatry and digital mental health technologies. And then I will be developing leadership and healthcare policy advocacy skills. As much as I have this plan, I recognize that there are so many factors that could impact on my plan. I'll be discussing them one after the other. The first one is the social factors that might affect my future plan. Number one is health literacy. Mental health stigma, which involves cultural beliefs and attitudes. Family and social support systems. Social determinants of health. Substance use and addiction. We all know that social factors does play a significant role on individuals' mental health and their ability to access care. As a future psychiatric and mental health nurse practitioner, I will strive to understanding each patient's unique circumstances and provide compassionate, holistic care that supports their emotional, psychological, and spiritual well-being. Yet another factor is the legal. The legal factors that might impact my plan include the scope of practice laws. Each state in America has different scope. Some are fully permitting nurse practitioners to practice, others are very, very restrictive. This scope of practice could impact my future plan as a psychiatric and mental health nurse practitioner. Other factors legally is the prescriptive authority regulations, the licensure and certification requirements, the reimbursement and insurance policies, telehealth regulations, and mental health and involuntary treatment laws. Legal factors shape every aspect of psychiatric and mental health practice, from prescribing medication to documenting care and providing telehealth services. Understanding the scope of practice laws, patients' rights, privacy regulations, and liability issue is essential for me to provide a safe, ethical, and effective psychiatric care. Another factor is economic factors, which includes mental health work strategies, healthcare reimbursement policies, telehealth economics, socio-economic determinants of mental health, cost of mental health services, insurance coverage limitations, and the rising healthcare cost. We all know that global factors really does impact, economic factors really does impact on the plan as an effective nurse practitioner. By understanding that these factors does impact on my future plan, I will be better prepared to deliver efficient, high-quality mental health services while advocating for greater access and affordability for my patients. The next factor is the global factor that might impact on my plan. This includes the global mental health burden, the shortage of mental health care providers, the global stigma surrounding mental illness, the emerging global health crisis, the expansion of telehealth and digital psychiatry, the cultural differences in mental health perspectives. Global factors we do know significantly will impact mental health care delivery. And as a prospective psychiatric and mental health nurse practitioner, awareness of these global factors will aid me provide culturally sensitive, evidence-based, and compassionate care while contributing to improved global mental health outcomes. The next slide is on my pioneer. My model is Hildegard Pepler. She's the mother of psychiatric nursing, who developed interpersonal relationship theory. She influenced modern psychiatric and mental health role in therapy, communication, and mental health assessment. Hildegard Pepler emphasized the importance of the nurse-patient therapeutic relationship, and she promoted the idea that nursing is a healing and interpersonal process. Her contributions will continue to shape my practice, my future practice as a nurse practitioner psych, by reinforcing the importance of patient-centered and compassionate care. The Christian worldview and the beatitude. As a Christian, I believe that my Christian worldview will aid me to being a better nurse practitioner psych. And one of the beatitudes I chose today is, blessed are the merciful, for they will obtain mercy, in Matthew chapter 5, verse 7, one of Jesus' sermon on the Mount. The application of this beatitude to my future psychiatric and mental health nurse practitioner role will include It will help me integrate faith-informed values such as kindness, patience, and humility into clinical practice. My Christian worldview of mercy will enable me show mercy and empathy towards my patients, individuals with mental health illness. It will enable me provide a holistic care that supports emotional, psychological, and spiritual healing. It will enable me advocate for the vulnerable and the underserved population with fairness and compassion. It will also enable me advocate for a reduction in stigmatization by promoting understanding and grace in mental health treatment. Mercy, we all know, is compassion put into practice. When people suffer from struggle with depression, anxiety, other psychiatric conditions, mercy does not demand that they simply overcome their feeling. Neither does mercy persist that it is because of their lack of faith. Rather, mercy responds with empathy. Mercy offers a listening ear and provides support, encouragement, and remains ever present. In conclusion, my goal as a prospective psychiatric and mental health nurse practitioner is to be guided by a Christian worldview grounded in compassion, mercy, and respect for human dignity. I will be guided by Paplow's therapeutic relationship model. I am committed to becoming a compassionate and competent psychiatric and mental health nurse practitioner. And I will continue to grow through advanced training, lifelong learning, and professional development. So help me God. Thank you all for listening and watching my presentation. The last two slides are on my references, and thank you once again for being a part of this presentation. Do have a blessed day.